So today I'm going to talk about the bones. If you remember from the last lecture, I said the bone and the cartilage are considered as a specialized connective tissue, and we consider them as a connective tissue. The reason for that, both of them, they have cells, fiber, and matrix, which is the same as the characteristics and the component of the connective tissue. And the second thing, they provide the support for the entire body. Furthermore, they are in relation and related to other types of connective tissue during the embryonic development period. So before we talk about the histology of the bone, first we need to talk about the function, the first function, which is the protection. If you remember, we said that the brain and the spinal cord and our heart and lung are supported and protected by the bone. Our brain and spinal cord found in the cranial cavity and in the spinal cavity. Furthermore, the heart and the lung found inside the bony thorax. Both of these tissues are soft tissue, delicate tissue. The presence of the bone make a protection for these organs. The second function, which is the site of the attachment for muscle and tendon. If you remember from anatomy, every muscle has origin and insertion, and we said that the origin and insertion usually in the bone extend from one bone to other bone, and this attachment usually is by tendon. The other function, which is the house of the hematopoietic tissue. Inside the bone we have the bone marrow. Inside the bone marrow we have the cells that are responsible for the protection of the red blood cells and the white blood cells. Finally, they are the storehouse of the calcium and the phosphorus. Whenever there's increase in the concentration of calcium and phosphorus in the blood, they are going to be stored in the bone through the formation of a new bone. However, if there is a reduction in the concentration of calcium and phosphorus, there will be a process, we call it as bone resorption. By this I mean bone is going to break down, and this will result in the release of calcium and phosphorus in the blood. Usually we have bone versus bones. Usually bone is used for gross anatomy, whereas the bones is more like histological term. Usually the bones, if you remember from the anatomy, we said we have the compact bone and we have the spongy bone. The compact bone usually found at the area of the body or shaft or diaphysis. However, for the spongy bone is found inside the marrow cavity and in the area in the proximal and distal extremity of the bone. The other name for this bone, which is the spongy bone, we call it as cancellous bone or the trabecular bone. However, the area of the shaft and body, we call it as the area of the compact bone. And you can see both of them merge together. There is no true separation between the compact bone and the spongy bone. As I said in the beginning, bone is a specialized connective tissue, but there is very important thing here. The matrix is calcified. The matrix is hard. It's not like the cartilage where we have the matrix is a soft tissue. So the definition of the bone, again, it's calcified matrix with osteocyte embedded in this matrix. As I said before, the main component of the adult skeleton. If you can see, most of our body, we have muscle, and the second thing, we have the bones. As I said before, bones protect the vital organs, such as the brain, spinal cord, the bony thorax. Also, they are the reservoir for the calcium and the phosphorus. 99% of the total body calcium is stored in the bone. The other thing, and very important, bone is a dynamic tissue, undergo shape change with the time period. Whenever there is increase in the calcium, there will be lay down of more bone. However, if there is reduction in the calcium and the phosphorus, there will be bone resorption, bone breakdown. So this process is continuous. Sometimes the calcium level increase the blood, so we need to build bone, and sometimes there's a reduction in the calcium level in the blood, so we have to break down the bone through the process of the bone resorption. So the bone don't have a constant shape. Usually there is a constant shape change. So we'll start with the components of the bone. If you remember, any connective tissue have cells, fiber, matrix. So we'll start with the matrix. Both have inorganic portion, and also we have the organic portion. For the inorganic portion, which is the minerals, and usually this is responsible for the calcification of the bone. Usually this part is made of calcium, phosphate, bicarbonate, citrate, magnesium, potassium, and sodium. Around 50% of the dry weight of the bone is mineral. Usually the name of the minerals, we call them hydroxyapatite crystal. So when I say hydroxyapatite crystals, mainly I'm referring for the minerals that found in the bone matrix. Also, we have the ground substance material, which is the glucosaminoglycan and protoglycan. We have chondroitin sulfate, and we have the keratin sulfate. For the fiber type, we have the type 1 collagen. So we have here matrix and fiber. The fiber, which is type 1, for the matrix, as I said, we have two portions. We have the organic portion and we have the inorganic portion. The inorganic portions, which is the minerals, whereas the organic portion consists of the glucosaminoglycan and protoglycan, is chondroitin sulfate and keratin sulfate. In addition, for the fibers, which we have in the bone, which is type 1 collagen. There's two types of bone. We have the primary bone and we have the secondary bone. The difference between them, the primary bone usually is the immature, whereas the secondary bone, which is the mature. The immature is the first bone that form in the fetal development and bone repair. So the first bone that form in the embryo, we call it as the primary bone, immature, or the woven bone, and usually this replaced in the adult by the secondary bone, which is the mature or the lamellar bone. The first bone is formed after the bone fracture. Whenever we have a fracture in the bone, at the beginning we'll have cartilage, then replaced by the bone. The first bone replaced the cartilage, usually is the primary bone, then it's going to be replaced by the secondary bone. The secondary bone, as I said, which is the mature bone or the lamellar bone, we have two types. We have the compact, which is the dense, and usually it's found in the outer portion of the bone, usually found at the area of the shaft, body, or diaphysis, whereas the spongy bone, which is the meshwork of trabeculae in the bone. And as I said, this bone, we call it spongy bone, cancellous bone, or the trabecular bone. And as I said, it's only found in the adult. So this area here again, we have the area of the compact. You can see this is the area of dense without any spaces, closely packed bone, and usually found in the area of the diaphysis. However, the area here, you can see a lot of spaces, look like the sponge. So that's the reason that they called it as the spongy bone. So let's talk about the bone organization. First, I will start with the compact bone. To understand the bone here, we have to know that the bone at the area of the diaphysis, almost like a tube. So we have the area inside and we have the area outside. The area inside, which is limit the bone, we call it as the inner circumferential lamellae, whereas the area that found outside, we call it as the outer circumferential lamellae. So this area here, which is the mark, the external border of the bone, the compact bone, we call it as the outer circumferential lamellae, or the external, and the area that found inside here, we have the inner circumferential lamellae. Between them, between the outer and the inner, we have this cylindrical structure, and this cylindrical structure extend in all the area of the body or the shaft, which is called the osteon. The osteon, you can see here, this is a cylindrical structure. Usually consists of concentric lamellae. Okay, these structures are called the osteon, or sometimes we call it the other name, which is the Haversian canal system. And usually these osteons are connected to each other through a canal. We call it as the lateral canal, or the other name, which is the Volkmann's canal. So you can see here, we have the border inside and the border outside. The border outside, the external circumferential lamellae, and from the inside we call it as the inner circumferential lamellae. Between them we have this structure, which is a concentric lamellae. It's just circles around each other. We call it the osteon or the Haversian canal system. As I said, these osteons connect to each other through these lateral canals. We call them as the Volkmann's canal. Again, from outside, this is the external, and this is the area of the internal. Between them, we have this structure, which is the osteon. As I said, it is concentric lamellae, circle around each other, and there's space in the center. This space we call it as the osteonal canal or the Haversian canal. In these spaces, usually we have the blood vessels, the nerve, the lymphatic, and the artery. Between these lamellae, there is a space. Inside this space, we have the osteocyte. These spaces again is the lacuna, and this space, as I said before, is only found in the cartilage and the bone. So again, this area here, lacuna. Inside this lacuna, we have the osteocyte. What is the osteon? Osteon is the basic unit of the compact bone, and it's found at the area of the diaphysis. As I said, it's a cylindrical structure, extend from the beginning of the compact bone, from the proximal to distal extremity. As I said, at the center we have this space here, we call it the osteonal canal, and inside this osteonal canal we have the artery, the nerve, the vein, and lymphatic vessels. As I said, this osteon is concentric lamellae, circle around each other. Between these circles we have the lacuna. Inside these lacuna we have the osteocyte. Usually these lamellae is composed of the collagen fiber type 1, and usually it's impregnated and hardened by deposition of the minerals. Again, this is the osteon in 3D. As I said, it consists of collagen fiber, and we can see these collagen fibers runs at the right angle from each other, and this is very important because this increases the strength of the osteon. As I said, between these lamellae we have the lacuna. Inside this lacuna we have the osteocyte. Inside, which is the osteonal canal, we have the artery, vein, nerve, lymphatic vessels. The lining of the osteon canal, which is not surrounded by the bone, we call it as the endoosteum. And at this area here, we have the osteoblast. And sometimes we call it as part from the endoosteum layer. Again, this is the area of the osteon, concentric lamellae. Between lamellae, we have the lacuna. Inside lacuna, we have the osteocyte. At the center, this space we call as the Virgin canal or the osteonal canal. Inside it, we have the artery, vein, nerve, lymphatic vessels. Very important here, I need you to see. You can see this is lacuna, and you can see here from one lacuna to another lacuna, extend this short canal. This short canal, we call them as caniculi. And inside these caniculi, we have the cytoplasmic processes of the osteocyte. Again, you can see here, this is the area of the lacuna, and you can see here, this is the caniculi. From outside, as I said, we have the external, and inside we have the inner circumferential lamellae. And all these spaces, we have the lacuna, and inside this lacuna, we will have the osteocyte. As I said, we have these caniculi, and you can see here, the cytoplasmic processes of the osteocyte. They are very long and they extend from one lacuna to the adjacent lacuna, and this is very important in two things. The first one, in gap junction. If you remember, when we talk about the gap junction, we said it's a small pores between the cells. As I said, in these pores, minerals will pass from one cell to another cells, and this equal for the information transmission from one cell to another cells. And the other thing, these cytoplasmic can extend and relax, and they work as a pump that will be responsible for the movement of the nutrient and oxygen from one lacuna to the adjacent lacuna. So again, here we have the osteon, and we have these here lacuna, and we can see these branching here. All of these are caniculi. As I said, in these caniculi, we will have the osteocyte cytoplasmic processes. This is what we're going to see in the lab. See this one here. We have the stone, our Haversian canal system. In the center, we have the stonal canal or the Haversian canal. As I said, we have the artery, vein, lymphatic vessels. As I said, we have the concentric lamellae. Between these lamellae, we have lacuna. Inside these lacuna, we will have the osteocyte. Very important, bones are not naked. If you remember from the anatomy, we said that the bone is surrounded by the periosteum, and you can see here it's extend almost from the proximal extremity to distal extremity. However, they not extend at the area of the articular surface. However, at the area of the articular surface, we have the hyaline cartilage. We call it as the articular cartilage, and mostly it's hyaline cartilage. And in the area between the proximal to distal extremity, we'll have the periosteum. So the bones are not naked. So what is the bone periosteum? Usually it's layer of non-calcified connective tissue covering the external, except at the synovial articulation, which is the articular area. It consists similar to the perichondrium from two layers. We have the outer fibrous, which is dense irregular connective tissue, and the inner, which is the inner cellular, and usually contain the osteogenic cells. Between the periosteum and the bones, there will be Sharpey's fibers, and these usually type 1 collagen, and usually the main function is to attach the periosteum to the bone, and in the periosteum, again as the cartilage, we have the blood vessels, and these blood vessels are responsible for the nourish of the bone. As I said, we have periosteum. From outside, inside, we have the endosteum. As I said, the endosteum lines the marrow cavity and usually contain two important type of cells. We have the osteoprogenitor cells, also we have the osteoblast, and these two cells are very important in the bone growth and bone repair. Now I'm talking about the trabecular bone or the spongy bone. As we can see, here we have these trabecules. It's almost like spicules, and these spicules, they are interconnected with each other. You can see here we could not see the stonal system or the virgin canal system. We have these lacuna. Inside these lacuna will have the osteocyte, and the cell that found at the periphery are not covered by the bone. Usually these cells, which is part from the endosteum, it could be osteoprogenitor cells or the osteoblast. Again, you can see here, this is image with higher magnification. From the previous image, we have the lacuna. Inside this lacuna, we have the osteocyte, and the cells that here are not covered by the bone. These cells are the endosteum, and usually this cell, it could be the osteoprogenitor cells or the osteoblast. So now I'm going to talk about the cells of the bone. We have four types of cells. The first cells, which is the osteoprogenitor cells. The second one, which is the osteoblast. If you remember from the cartilage, we said that the the chondrogenic cells will differentiate into chondroblast responsible for the production of the matrix and the fiber. Here is the same. We have the osteoprogenitor or the osteogenic cell. It is the same cell which is found in the inner layer of the periosteum and the endosteum. Usually these cells are flattened and spindle shaped, almost like the squamous epithelium, and these cells can differentiate into the osteoblast. Once differentiated to the osteoblast, then the cell will be the active cells, which is responsible for the secretion of the collagen and the ground substance. Before the ossification and mineralization of this matrix, we call it as the osteoid, which is the unmineralized bone. Usually the osteoblast play a role in the mineralization of the bone. Usually the shape is cuboidal to polygonal. So to differentiate between the osteoprogenitor and the osteoblast, the cells that are flat are the osteoprogenitor. The cells that cuboidal or polyhedral, this cell will be the osteoblast. The easiest one to find is the osteocyte, because this osteocyte is found in the lacuna, in the compact bone or in the trabecular bone. These cells responsible for the maintenance of the bone matrix play a role, a limited role, in the synthesis and resorb of the matrix, communicate with each other, osteocyte with other osteocyte or osteoblast, through caniculi and gap junction. And if you remember in the slide before, we talked about these cells have very long cytoplasmic processes, and I said that these processes extend inside caniculi and will make contact with the adjacent osteocyte. And as I said, this gap junction is very important in the information transmission from one cell to another cells. So we can see here, this is the osteocyte inside the lacuna, and we can see here these cells has a very long cytoplasmic processes, extend and entering through the caniculi. The last cell I want to talk about, which is the osteoclast. This cells is multinucleated cells. The cytoplasm acidophilic. Usually these cells phagocytic lineage macrophage lineage phagocytic cells. The origin of these cells is the monocyte. Okay, these cells is very important in the process of the bone resorption, the bone breakdown. As I said, when there's a reduction in the calcium and the phosphorus in the blood, these cells are responsible in the process of the breakdown, the bone resorption, and this will result in the release of the calcium and the phosphorus in the blood. Usually these cells release lysosomes in the extracellular space, and this is responsible for the bone breakdown. Usually there will be a formation of thing we call it as the Hauschep's lacuna, which is a depression in the bone created by the osteoclast. So the cell here, you can see the cell here, this is the osteoclast. This is multinucleated. We can see the cytoplasm. The color is pink, so that's why we said it's acidophilic. And we can see here, this is the area of the depression. This is the area of the Hauschep's. And at this area here, there will be a release of the lysosome, and this will result in the breakdown of the bone. As I said in the beginning, we have the osteon, and the osteon make a contact with the adjacent osteon through the lateral canals, or the other name, which is the Volkmann's canal. So these lateral canals, very important, connect adjacent osteon. The other thing, they are the route for the blood vessels through the hard material. The innermost of these lateral canal will reach to the marrow cavity, whereas the outermost will reach to the periosteal space. So here you can see this is the lateral canal. This one here, the inner, extend to the area of the bone marrow, whereas the one outside reach to the area of the periosteum. And you can see here from this area here, we have the nutrient foramen. From this nutrient foramen, the artery will enter, and still here enter through the periosteum, then start to ramify and reach to the osteon, and from one osteon to the other osteon through the lateral canal until reach to the area of the bone marrow. And the same will be for the vein. The vein will enter from this area here, from the lateral to the osteon, lateral osteon, and then exit through the nutrient foramen. So the artery enter through the nutrient foramen, whereas the vein exit through the nutrient foramen. And very important, we have the lateral canals. So as I said, arteries penetrate from the periosteum, ramify through the sternal and the lateral canal, perforate to reach the area of the bone marrow. As I said, finally, veins will follow return routes. Nutrient and waste transport in the bone, diffusion cannot work because the bone has a calcified matrix. It will be very difficult for diffusion. Remember, in the cartilage, we said the cartilage avascular, aneural, and depend in the process of the diffusion of the nutrient and oxygen from the pericardium toward the cartilage. Here, diffusion is very difficult to provide the oxygen and the nutrient because the matrix is calcified, and there will be no way to the diffusion to happen. Okay. Furthermore, inside this lacuna, I said we have this osteocyte, and these osteocyte, they have small channels, which is the caniculi, and I said in these caniculi extend the cytoplasmic processes of the osteocyte. As I said, this cell can extend or retract, okay, and this will result, and these cytoplasmic processes work as a pump, and this will be responsible for the movement of the nutrient and the oxygen between different lacunae. Furthermore, I said these cells, they have the gap junction, and this is very important for the information transmission from one cell to other cells. Thank you.